COVID-19 by Hunter Burton and Hunter Kilpatrick. What is it? COVID-19 is a SARS-CoV-2. It is in the coronavirus family. The coronavirus family was discovered in 1960. It's called the coronavirus. It got its name from the spike-like surface. It's a part of a large family of respiratory viruses, including the Middle East respiratory syndrome. It is a RNA virus. What is it? The pandemic. In 2019, a group of patients in Wuhan, China came with pneumonia-like conditions. In January 2020, the first lab-confirmed case of 2019 in the U.S. was in Washington. And March 11, 2020, the COVID-19 was labeled as a pandemic with 118,000 cases in 14 countries with 4,000 deaths. On December 11th, 2020, the FDA issued an emergency of authorization for the Pfizer vaccine. COVID-19 enters the body airborne through respiratory droplets like coughing, like I've been doing, or like sneezing, or just their breath. This happens. It can be transmitted on surfaces, so like hands to mouth. The virus has proteins which connects to the receptors on the host and initiates the RNA exchange. This first happens in the nasal and larynx area, and then it goes down the respiratory tract into the lungs and causes flu-like symptoms. COVID-19. Why is COVID-19 dangerous? COVID-19 is not super dangerous to a healthy young person, but it gets very dangerous when it's a person who has underlying conditions such as diabetes or being overweight, or also old people. Symptoms for COVID-19 can be fever, cough, sneezing, loss of smell, loss of taste, nausea, vomiting, diarrhea, chills, body aches, headache, and shortness of breath. Symptoms come sometime about 5 to 6 days after being infected and can last 1 to 14 days. Some patients are asymptomatic. Treatment most patients can recover without major medical intervention. The initial treatment was rest with fluids, anti-inflammatories, and antibody infusions. Preventions include masks, social distancing, sanitization, and the 3 vaccines.